Good evening, everyone, and thank you for joining us again tonight. Before we get started, I would like to read the brief disclaimer that you see on your screen. And that disclaimer is this: the PharmAssist virtual learning experience, brought to you by Mandel's Clinical Pharmacy, is intended only as an educational program for patients. Any clinic-specific information shared by the nurses is the opinion of the nurse and is not intended to replace the recommendations or requests of your healthcare professionals. All medications will. Good evening, everyone, and thank you for joining us again tonight. Mandel, there you Before we get started, I would like. Thank you. The internet was having a delay. Apologize. All medications will be dispensed by Mandel's Clinical Pharmacy according to the prescription as written by the provider. And with that out of the way, and the internet not trying to destroy me right now with the delay there, I would like to introduce myself. My name is Craig Orpello, and I will be your host tonight. And I want to welcome you once again to the PharmAssist Virtual Learning Experience, an educational program created exclusively by Mandel's Clinical Pharmacy to bring you together with some outstanding healthcare professionals right from the comfort of your own home. If this is your first time joining us, thank you so much for making time for us tonight. And if you have been here before, thank you again for coming back. The PharmAssist program takes place every Monday night at 7 p.m. Eastern Standard Time. Tonight, we will be providing a live medication instructional program on 3 common fertility products, including an interactive Q&A program throughout. And you're probably wondering, how does that take place? Well, that's where you come in. You can join us via Zoom or Facebook Live, and we invite you to be a part of the discussion by sharing your questions in either format, whether in the chat or right into the Q&A section in Zoom. As always, we are joined by various amazing HCPs each week from across the nation to provide you with a real-world experience, just as if you were sitting across the table from them in their clinic. And tonight, we are joined by Wanda Hofgesang. So I want to say thank you again, everyone at home. Thank you, Wanda. And I want to turn it over to you. Wanda, why don't you take it away?
Hey, Craig, thank you so much. Welcome, everyone. My name is, as Craig stated, Wanda Hofgesang. Actually, that's kind of, with that little delay, makes me think of my name that I told him about. We're going to call this Wanda Virtual Learning Experience for those of you maybe watching the show WandaVision. So just wanted to give you a nice welcome this evening and let you know that I am a reproductive endocrinology nurse in the Northern New Jersey area with lots of years of experience. So I always feel that education is so great when we have an opportunity to be able to provide that to you as a patient when you're about to go through a fertility cycle. And this live question and answer is wonderful with the videos that we have. So just to let you know, as Craig stated, we are going to talk about 3 medications tonight. This evening, our 3 medications are menipure, Hcg, and Sonera patch. So those are the 3 medications that we will be showcasing tonight. And we will also have the live Q&A after the videos. All your questions, if you can, we want to remain keeping them somewhat focused on product usage. Certainly, if you might have a specific medication question relative to your dosage or something about you personally, we want you to know that we always have to refer you back to your clinic, to your healthcare provider, because they are the ones that are helping guide you with your specific instructions. So that's just real important to know, but we're happy to answer any question that we can. And you can always ask that when we get to that live Q&A part of the evening. And our goal really is to help you become a pro with your medication technique. And so we really feel that by watching the videos and the steps it takes from beginning to end to get that product ready for injection, it's really so important that you feel comfortable with that process. And the nice thing about this is this video, along with previous videos, are on the PharmAssist program, and they are available through YouTube, Facebook, and also through the Mandel's Facebook page. But also, if you go on www.mymandels pharmacy/pharmacist, you will be able to watch this video, like I said, or any of the prior videos. So if there's a medication that you might be starting tonight and you don't see it in this 3 repertoire that we're going to go over, certainly it might be on one of the other videos. So we encourage you strongly to take a peek at that. That would be really good for you to know that it's there. I sometimes find patients really need to see the videos more than once. It's very helpful. And also it's helpful on the night that they are doing their product to have that available again, to maybe put a pause and get yourself caught up to that point while you're going through your own mixing and administration technique. Before we get started with that first video of menipure, one of the things I'll say that is really helpful is when you do receive your medications from the pharmacy, it might be a little overwhelming at first because when you open your box, there are several different medications that are part of a fertility cycle, but it doesn't mean that they're all happening at the same time. So I wouldn't want you to worry when you see lots of medications. I think the biggest thing is to organize like items together. So you might have multiple boxes of the same product. Don't let that worry you or scare you. That's what you need for your whole cycle. So your nurses have worked on with the pharmacy's help to get you the medications that you need to get you from start to finish. So what you want to know about that is just putting those like items together just gives you a sense of organization, I think, to the cycle. And sometimes there are also some packaging issues that you might see in terms of storage, whether something might need to go in the fridge or to stay outside at room temperature. So that's a great way to figure that out up front and have that all in place, because not everything needs to go in the refrigerator. And that's just an important thing to note. So you take that box and open it up and put everything in an organized way for yourself. And that just, I think, can be one step prior to these videos to helping you feel a little more organized for the cycle. So without further ado, I think we are ready to get started with our first video, which will be the menipure. This video is to help you with the mixing and administration of your menipure injection. Menipure will come to you from the pharmacy in a box, a couple different boxes. They may be a little bigger than this, but this is right now what the box looks like, just in case you're wondering what it looks like and you have it at home. So you want to get that box from your safe place. It does not need to be refrigerated, so you may have this just in a cabinet, which is great. That's fine. If it's in the fridge, it's not wrong either, but it doesn't need to be in the refrigerator, just so that you know. The supplies that you'll need from, oh, nope, I'm going to rewind that before I jump ahead of myself, just to let you know what menipure is. Menipure contains the hormones of FSH and LH, and both of those hormones work in harmony with our body, again, to help with recruitment and development of multiple follicles, which turn into multiple eggs for possibly insemination or for IVF retrieval. So the menipure is FSH and a little bit of LH. And we have both of these hormones in our bodies naturally. And when we're administering these into our bodies via an injection, it's putting a little bit more into our system to help us recruit several eggs and mature eggs, which we don't normally have several mature eggs during our natural cycles. So that's really just that's the goal of it, just so you're wondering, why am I taking this? And that's always important to know the why. I think it helps. It helps you to understand. The other part of menipure is, where do I inject it? Menipure is injected into either the lower belly, lower abdomen, or the upper top, upside outer thighs. That's routinely where we have our patients doing that injection for the fertility clinic I work with. And I think most often that's where most everybody is as well. So the injection goes in the lower belly and or the upper outer thigh, which is a subcutaneous injection. So those injections, you have an option of either self-injecting or someone gives you the injection. And that option, again, is yours. It's not one that it should be your individual choice to figure that out. We want you to feel comfortable with administering this medication. So if you are able to administer your own medicines, great. If they concern you to do that and you want to enlist the help of a significant other, then that's fine too. Do whatever makes your fertility cycle journey the most comfortable for you. So with regards to menipure, where the supplies that you will need for that is going to be, you will need vials of menipure that contain a powder or a tablet or a wafer. You know, everybody refers to that a little differently, even amongst nurses, but just so that you know, you will have little vials that'll have a powder or a tablet, and that will be what's in this box that you have of your menipure. And you will also need to have a Q-cap, which is going to be supplied with you as well. Pardon me for having that upside down, Q-cap. So you need one of those for this medication. You also will need a 3 cc syringe. If it has a needle on it that is long, then you are going to remove the long needle. Just depends what you might get from the pharmacy. They may send you a syringe without any needle in the package, and that's great. That's what you need, because this is a 3 ml, 3 cc syringe. But if it has a needle attached that's very long in length, remove that needle and discard it in your sharps container, because you do not need that long needle for this. Remember, I said this is a subcutaneous injection, which anytime you hear that buzzword or a belly or a thigh shot, that means that it's a tiny injection needle that you will be using to inject with into your body. And then lastly, what you'll need is a 1/2-inch needle. The pharmacy might send you either a 27 gauge or a 30 gauge. Just so you know what those 27G and 30G mean, the higher the number just means the thinner the needle. So the idea here is oftentimes for subcutaneous injections, most commonly it'll be a 1/2-inch needle and a 27 gauge. And usually that has a gray outer little labeling system on it when you get it. Once in a while, the pharmacy might send you a 30 gauge, and that's fine to use too. So there's flexibility with some stuff, and where there is, we want you to know it's okay. But if you're ever confused or you ever have a question, obviously your nurses at your centers are always there to help answer any of those questions that you might have about your menipure supplies. So once you get your supplies, our next thing is to, again, mixing and administering a medication is not a sterile technique, but it's a clean technique. So it's a good idea to wash those hands, use a little hand sanitizer if you're not near a sink. I'll just use the hand sanitizer for showing you to make sure that you do know that it's always good to clean those hands. And when you have everything set up, then you're ready to go. So the first thing that we would do with our menipure is we would have to know our dosage. Your dosage that you might get from the nurses, they may refer to it as you're going to mix 1 powder or 2 powders or 3 powders. We just find sometimes it's easier for patients to understand that, since the 2 types of vials you'll have are powder and or water. So what you want to know is that she will tell you how many powders, but she may also give you a number. With menipure, each powdered vial is equivalent to 75 units. So if you're a patient that's taking a 75 unit dose, you're mixing 1 powder. If you're a patient that's taking a dosage of 150, you're mixing 2 powders. I think the other thing I've always gotten asked about that, is it 2 shots? Nope, it's not 2 shots. It is simply 1 injection, but the strength of that shot is 2 powders. So that's what's important just to know right off the bat. Don't worry or get concerned or panic that you have 2 shots because you're doing 2 vials. It's 1 injection of menipure, but your dosage could be a little less or a little more. And what determines that is your doctor at your clinic, based on your history, your diagnosis, and your plan, your age. All of these factors go into effect in coming up with a protocol of which medicines, what dosages, etc. So if my dosage, and I'm going to show both. If I were 75, 1 powder, or 150, 2 powder. So first off, what I do is I take these little plastic tabs that are on top of these vials and I remove them. Okay. Under there, it is sterile. However, like I say, the nurse in me is always wanting to clean the surface of anything that I'm sticking a needle into. So I'm going to clean the surface of these vials for us so that we get ready for our mixing. So we'll clean them, put them down. The next vial you will have is a vial of sterile sodium chloride. You take off that little cap. Once again, get a little alcohol prep pad, clean the top of that. So first thing you're going to notice is I'm only taking 1 vial of water. The ratio, how I always say it to patients, no matter how many vials, how many powders, what number of menipure you're mixing, always 1 vial of water, sterile saline, sterile water, to however many powders you need to mix. And it's always 1 shot. That's the key. So 1 shot, 1 water, but the variable is the number of powders that you need to mix for your dosage. And that dosage could periodically, potentially through your cycle, need to be changed and adjusted based upon your response to your cycle. So just know that this is a variable, but your nurses will guide you every time in telling you what you need to take and how many vials you're mixing. The next step is going to be to grab your syringe, and you're going to open up your Q-cap package, and you will twist your Q-cap onto the syringe. It threads right on there and it twists. Our next step is going to be that we're going to go into this vial of sterile water. okay? In the vial, we're going to draw up 1 ml. There's a little pressure in that vial when it's new, and it can make it a little difficult sometimes to draw down. The pressure will push on the plunger. So a way to handle that is if whatever you're drawing out of the vial, you inject that amount of air, it'll help equalize that pressure. So draw back to the number 1, lining up the rim of the plunger just on that number 1 line. The Q cap just gently pushes down on the top of the vial. Turn it upside down, and you'll see when I push, it's going to bubble. And then when I let go, you're going to see that it pushes down on my plunger because of that pressure. But eventually it stops because I did that little tip of adding the air. So what I want to do with this vial is I want to draw up 1 ml. So I would draw down to the number 1, filling it up with 1 ml. One thing to let you know about your menipure is you will always have extra water when you draw up the 1 ml because they put 2 mLs per vial of sodium chloride sterile saline. So what you want to know is if there's extra water in here, that's okay because you're only drawing up to the 1. Once you draw up to the 1 and you have it in the syringe, just wiggle that vial off and discard it. Do not save these sodium chloride vials, not necessary. You have enough in your supply with your prescription. So that can go in regular trash. You will take your first of your powders, attach the Q cap, push down on the liquid. When that water hits that powder, it's like cotton candy hitting your mouth. It melts. So that little powder and that little wafer just dissolves. You can roll it around gently, but don't shake. You just want to reduce the bubbles. So you gently roll it around, keep the needle attached to it. Once it looks like it's all mixed, you're going to drain, drain, drain all the way down to that 1 ml. So I'm going to drain all that fluid that I just mixed in there, which is 1 ml went in, 1 ml comes out. Now this vial is empty. I do not save it. There's nothing I need it for. So I will once again toss in my regular trash. If I were doing a dose of 75 units, 1 powder, now I'm actually done. I do not need to mix anymore. I would take this Q cap off and attach my injection needle. But because I want to show you also how to mix 150, if you're doing 75, you would take the Q cap off after mixing 1 vial and we would put on the injection needle. But if we still need to mix 1 more vial because our dosage is 150, 2 powders, then we're going to keep that same syringe with that same liquid, which has one of the vials of menipure dissolved already, and push both powders together now with that 1 ml. Roll it around, let it mix, draw it back up. And here's where, when you're done with your mixing of your number of powdered vials, all you need to do is twist off the Q cap with the vial, and that can go in regular trash because no blood has come in contact with that. You will then take out your little 27 gauge half-inch needle to inject. If I had any bubbles, I give a little snap to the syringe and that helps the air rise to the top. But if I don't do that step, is there anything wrong? Absolutely not. And I just want to help you right away because this is a mixing medication. Please don't panic about air. Air is more of a concern when you're in a hospital and I'm taking care of you and you have an IV going directly into a vein. Yes, air if you can, and you see a little bubble, you can always flick it. But there will be some little air bubbles you can't remove. And I don't want you to start pushing the medicine and letting it squirt and you're losing valuable drug. So the little bit of air is never going to hurt that little fatty tissue, FYI. Just know that so that you don't worry or panic if you have an air bubble there that won't move. Like I mentioned in the very start of the video, the injection area that we used for this is our lower belly or the upper outer thigh and top thigh. So all in here. And with menipure, because you will take it more than 1 injection, you'll do approximately 7 to 10 of these injections. It's just good to know that you can move around in that belly every time you give an injection. You move it around a little bit. You could then also incorporate using the thigh and do the thigh as well. So some ladies will do just belly shots. Some ladies will stick with their thighs, or some ladies might combine both. No right or wrong, whatever works for you is fine by us, as long as the medication, you have the right dose and the right area that you're injecting. With this medication, like I said, you could self-inject or somebody could give you the injection. So if somebody's giving you this shot, you could lay down. And when they're giving you this injection, the needle goes in at a 90-degree angle in your belly, a 90-degree angle in the top of the thigh, and a 90-degree angle into the side thigh. It's a 90-degree angle. If this were me right now and I'm standing and I'm giving my own injection, if you do give your own shots, which you can, then standing up, the injection 90-degree angle is just like this, the angle straight in. So what we do to get ready for that injection is we clean the area with a little alcohol, just clean that skin. Next step's going to be to pinch and have a little bit of fat. With pinching, be careful that you don't over pinch. I'm just going to show my arm here. When you pinch that fat, lift it a little bit gently. Don't squeeze and grab so tight. If you do, you might bruise, and you just don't want to have a bruise there. If you do get a bruise, some people can bruise from an injection. Don't worry. Just avoid going into the bruise when you give a new shot. It's not uncommon or unusual to bruise when you get your blood drawn or even given a little shot. Not to worry. It's just you want to avoid going into a bruised area to further cause any trauma to that area. So what we do here is we uncap our needle, gently pull it off. We're going to give that little pinch to the skin here. The needle goes in straight in. We do not need to jab. Once we put it to the skin, we're going to give a little push and it goes all the way. We let go of the fat and then we push that liquid right in. And then can do a 1, 2, 3 count. Remove the needle. And then what you want to do here, guys, is if your sharps container is nearby, you don't have to recap a dirty needle. You can put it right in the sharps container and then put the cap in there as well. But I'm just going to be safe for me right now and just cap it so I don't have a dirty needle lying around since I don't have my sharps container. But you would put this into the sharps container. With Menipure, you're never reusing any of your supplies to the next shot. Every night you do a shot of Menipure, you gather new supplies and you use all of those supplies up, and then the next night, new supplies. So nothing is ever left over with a Menipure shot. One last little thing I will mention about a Menipure injection is sometimes you may feel a stinging sensation when the liquid goes in, and there's nothing that you did wrong with that. They do use sodium chloride to mix the powder to dissolve it, and sometimes that's just a little irritating to the fatty tissue because we have a lot of nerve endings there. So if you ever feel a little sting, don't panic with a little tiny injection. You've got a lot of, think of a paper cut. Even though it doesn't sometimes go very deep, a paper cut's really sensitive when you get it because of all those nerve endings in that little fatty tissue. So same with the belly. It'll be very fleeting when you feel it, but when that medicine goes in, you definitely can feel a little bit of a sting. And if some of your other medications didn't have that sensation, you might question, did I do this right? And I just want to reassure you that indeed you did mix it correctly. It's just that that's the nature of that medication sometimes when it goes into the body. So I hope this video is helpful for you, and hopefully you will get started with your Menipure and be successful with your mixing, but certainly understand, give it a little bit of time. The first night's the challenge, and then after that you'll become a pro at your mixing of your Menipure. So as you can see with the Menipure, I think the biggest thing that is a part of the Menipure injection is the mixing. But I would want you to know that not all medications require mixing, but Menipure is one of those that needs some mixing. And I think the biggest thing to remember is use that Q cap if you can, because I do find that to be helpful with the mixing process. And it's a nice little needleless system to use. That manufacturer has developed in helping ease the mixing process. And then really you're only having to work with one needle, which is the injection needle. So sometimes I think it's difficult when they have different products and different needles and such, but once you know that that smaller needle goes with this Menipure, that's the only needle you really have to worry about. And then you're using the Q cap. So it makes it a lot easier to have something that's not a needle to mix, but then you put on a little needle for the injection. So I do hope that that, helped to kind of give you that overview of that medication. Craig, I don't know if we have any questions out there regarding menipure. I think that's one that always gets a lot of questions.
Yes, definitely. Thank you very much. So we do have some questions already coming in, and just a quick reminder to everyone out there, if you are joining us on Facebook, you can put your questions directly into the chat there. And if you're joining us via Zoom, you can put them either into the chat or the Q&A section. And that brings us to our first question. And so, Wanda, you touched on some of this stuff when you talked about just the mechanism of how menipure works and the what it's made of. But we always get this question. People really do like to know as many questions as we get that are very specific to side effects and things like that. We always get these questions about just kind of why am I taking this medication, or how does this medication work? And so this question came in and it says, so can you explain one more time, how does menipure actually work? Can it be used alone and in addition to other gonadotropins, or is it just one or the other?
That's a really good question. Definitely menipure can be used alone, or it could be used with one of the other gonadotropins. That term that's being used is, I just give you a couple of the brand names that we have on the videos, is your Gonalef pen, or your Follistin pen, or your multi-dose Gonalef. Those are other products that help to stimulate the ovaries. And sometimes for some patients, depending upon, again, age, diagnosis, history, the doctor will come up with a plan, a formula, and that formula encompasses which products combined might work best for you with your situation. And I think the key to this is just to say, with fertility, when you're handling a insemination cycle or an IVF cycle, you're looking to stimulate the ovaries to grow and develop more than one mature egg to hopefully increase the odds of pregnancy and the outcome. So this is a medication that's assisting in that process. It's going to help develop, let those ovaries recruit and allow to grow multiple follicles, which hopefully within that little follicle group, there will be a couple multiple eggs there for either an egg retrieval or for a insemination procedure. So really the key is menipure can be used alone or in combination, and that's all driven by your practice and your healthcare provider giving you guidance with that. And the key with everybody, though, when they are taking those products, is to increase the number of available eggs for an ovulation, for an insemination, or for an egg retrieval with an IVF cycle. And that's what that menipure is doing.
Perfect. Thank you so much, Wanda. I know one of the big things, sometimes people just want to get to the nitty gritty of, what potential side effects can I have, or what are the injection techniques I need to know. And the rest of the stuff, I just trust that they're telling me to go on it for a specific reason, right?
Right.
People really want to know why and how and all those kind of bigger questions. And that's really what PharmAssist is here for. Any of those questions that you may not have been able to ask during your appointment, or you forgot about, or right now you just kind of, some questions get sparked by our conversation. That's really what we're here for, is to try to make you be a pro now. So by the time you're ready to give that shot, you have nothing to worry about. So that's a great question. And thank you for that amazing answer, Wanda. And so this one is a little bit more specific. Somebody just wants to get right to it and know about how this product is, how long they're going to be on it. So the question comes in, how long am I going to be on my menipure, and when can I plan to come off of it?
So the menipure, or if it's taken alone or with those gonadotropins, typically on average in cycles, we might see that it would take you around a week, 7 to maybe upwards of 10 days. Is it possible I could be on them for 11 days? Yes. But I think that's an average for us to give everybody, is to say on average, it'll be a 7 to 10 day regimen of taking that injection daily, whether it be in the morning or evening, the time of the shot your healthcare provider will give you. But on average, I would say 7 to 10, it could be 11 days and whatnot. So it could be 12, there's an average there. And when you get off of this medication, it's usually right before the ovulatory drug that you take to prepare for an intrauterine insemination, if you're doing an insemination cycle, or you stop the menipure prior to or right up until the day that you're going to be ovulating and take an ovulatory trigger shot drug for an IVF retrieval. So it's taken for that 7 to 10 days while you are on that medication, and then right before you're ready for a ovulatory drug, that's when the menipure would stop, and you then dip into a new part of your cycle, which is helping to induce the ovulation and preparing you for procedures.
Yeah, great. And I think partially this question comes up quite a bit because there are people that want to know like a roadmap, right? There's a number of different products that you're going to be on. And so sometimes knowing when different products come into play and which ones are going to be multiple use, over time, over a week or so, versus which ones are only going to be used one time, and the timing is very important.
Yeah.
And having all that kind of mapped out in advance sometimes put to rest some of those questions or jitters or anything like that. And so that's why it's great that we're able to talk about this. Keeping in mind, obviously, to Wanda's point earlier and what she just mentioned, a lot of this is going to differ and depend on your actual clinic, and in the number of days you're going to be on it is going to be very specific to you and to your clinic's needs. But that's why here we're really trying to give you those, like an overview, like the average numbers, so you can get an idea and walk in. So if you're early in the process and you actually haven't even laid out that roadmap yet, this kind of gives you an idea of what's to come soon. So you can feel a little bit more comfortable and you don't feel like you are, blindsided or just kind of thrown out there and trying to figure it out on your own. That's what PharmAssist is really trying to help do on that as well.
Exactly.
So, perfect. Thank you, Wanda. And another question that comes in about this. And so now we're getting a little bit more into the whoops, I made a mistake questions, right? And these come up all the time as well. People always, I don't know if this is a hypothetical question or if this is somebody asking because it may have just happened to them, but we'll throw it out there anyway. And that question is, what if I made a mistake and I mixed/injected too many or too few vials of my menipure? Is that going to cause a problem with my cycle?
Good question. Good question. And I think the key to that is to let everyone know that, mistakes can happen and it's okay. Sometimes it's perfectly something that's manageable. I wouldn't want you to worry behind the mistake and be so concerned in communicating that mistake. So I think with all of us nurses that work at the centers, even the physicians, we are always, we're the intermediary. The nurses are between you and the physician sometimes during that cycle. And so we know enough to let you know that it's absolutely okay to let us know if something went awry when you were home doing your injection and you're not sure if you got everything, all the medication, or maybe you gave a little too much. Or maybe they made a dosage change and you didn't see that was changed in your, whether it be a voicemail was left for you and you didn't listen to it or what have you. It does happen. I've had it happen with patients and whatnot. What do I do with that? I always reinforce a calming presence to you guys to know that it's okay. Thank you for letting me know. And what I'm going to do with that information is take that to your physician and say, hey, patient so-and-so, this is what happened last evening. How would you like to handle it? Sometimes it might be we don't need to do anything. We're just going to let it be and note the mistake and then be able to just move on. Or sometimes we might have to, if you didn't get quite enough medication and the doctor thinks, yeah, you know what, let's have her take that other, a little additional vial tonight or something like that. So I think the biggest thing I would just say is to never worry. Don't add to your own anxiety by not owning a mistake, just letting us know. We usually can work around some of these issues. So that's just really important with the menipure. If that ever happens with that one, by all means, just communicate to your nursing team, your healthcare professional, and that way the nurses can then on your behalf speak with the physician to come up with a plan, a plan of action.
That's great. Thank you so much, Wanda. Because if that can put anyone's mind at ease, just knowing that, hey, this is not the first time that your nurse has seen this situation, and it certainly won't be the last. So it's always better to be more forthcoming and share. And if you make a mistake, just own it and find out what the next step can be. And just don't wait. And that's the key, is just don't wait, because the longer you wait, it might be more difficult to overcome the mistake. Whereas if you get on it right away, you have a better chance of coming up with a plan with your clinic on how to move forward. So
exactly.
Perfect. So with that being said, I think we have so far most of the questions that have come in on menipure. We have gotten through to every question that has come in on either Facebook or Zoom so far. As always, I want to let people know, if you don't get your question in yet, or you think of a question later on, do not worry. It's not that once we move on, you don't get a chance to ask anymore. We will certainly answer any question that comes in. But we will, as always, we like to give an extra 30 seconds or so if somebody is trying to get a question in real quick, or they thought of a question based on that answer that Wanda just gave. We'll give another 30 seconds and I'll throw it over to you, Wanda, if there's anything that you'd like to share, any stories you'd like to tell as we get ready to transition over to the next product.
So The medication that I just gave you was one that is injected subcutaneously, and you're going to see throughout some of the videos that there are several different medications that are administered in that same fashion. But there are sometimes some medications that might be administered, either subcutaneous or intramuscularly. So, those are the variations that we usually are going over here in the virtual learning video, the experience here that we're going through. So menipure is one of those ones that, although it's mixing, it is a mixing and then a little tiny injection. That's key, that I think that's just important for you to know. What you'll see is that we will be going to the next medication that we're going to be showcasing is going to be a medication that is called Hcg. Sometimes it has a couple different trade names. You might have a box at home that might say Pregnil, or you might have a box that says Novarel. And so that medication sometimes can be a subcutaneous injection or intramuscular. So sometimes that can be one or the other, and your clinic would review with you which way you might be injecting that. But in terms of the mixing, since we already sort of saw the menipure, it's very similar. So a lot of times patients are on the menipure first before they might need this injection of Hcg or trigger shot. So the nice thing is that you've already sort of mastered the mixing, if you will, prior to doing this Hcg injection, which is nice, because that's not a new concept then by the time this medication is introduced, and you've become sort of your own little pro, your own little expert in mixing. So the Hcg medication is what we will be showing you next, and just want you to know that it is one that can be given either subcutaneously or intramuscularly. But I would think the biggest thing with this one, very similar to menipure, it's already a mixing, it is a mixing drug that you will also mix. Where it falls in sequentially to the cycles is usually after, as I mentioned in the first one or two questions that we went over, it's administered after the menipure. It's right before you will have a procedure done, such as an insemination or maybe an egg retrieval. So it's what's helping us to prepare for those procedures. So Craig, if you're ready, I don't think we have any more questions for our menipure. I think we're ready to go to that video for our Hcg. Hi everyone, the following video is here to show you the mixing and administration instructions for Hcg. Hcg stands for human chorionic gonadotropin. Sometimes your pharmacy may have sent you a box that has the name on it Pregnil or Novarel, or it might say chorionic gonadotropin. Any one of those three varieties is your Hcg injection. And typically this is administered to induce an ovulation. Sometimes it's called the trigger shot by your nurse or by your clinic. When you're taking this, it's to, like I said, initiate an ovulation, and you might be preparing for a procedure to follow, such as an intrauterine insemination or an IVF egg retrieval. Your clinic will review specific mixing instructions for this medication, and they will review your dosage and the method of administration. For the video today, we will demonstrate that this medication can be given either as a subcutaneous injection or it can be given as an intramuscular. If we use intramuscular, we'll demonstrate that we use the buttock muscle for that. And with the subcutaneous, I will show you that it goes in either the lower belly or upper thigh area. Some supplies that you're going to need to get started with this medication, just to give you a little list here, is going to be your box that'll have Hcg on there, or Novarel, Pregnil. You'll have 1 vial of Hcg powder or tablet. So sometimes our lingo is, some nurses will call it a powder or a tablet. Either way, that's the same. You'll have 1 vial of sterile bacteriostatic water. You'll need a 3 cc milliliter syringe, one of those. And you will need 2 22 gauge 1.5 inch needles if you're doing intramuscular injection. If you're doing subcutaneous, you will be using 1 22 gauge 1.5 inch to mix the product. And then to inject it, you will be using a smaller needle that I'll demonstrate, but is a 27 or 30 gauge 1/2 inch needle, which is the tinier, shorter needle to go just into the fatty tissue. So it's always good to get your supplies together first. Then you can always wash your hands before you're getting ready to do this. Administering an injection is not a sterile technique, but it's always good to have clean hands when you're mixing the product. So what we'll first do is from our box, we will remove the 2 vials that we will have. One of those vials will have the powder in it. We'll simulate that with this one. There'll be a little plastic cap on the top that you remove. And the other vial will have sterile water, which you can see sort of here that we have some water in this one. And you take the cap off, the little plastic cap off that as well. Another good idea to do is that you will use a alcohol prep pad if you have it, or a cotton ball with alcohol, and you'll just wipe the tops here with alcohol. It's just a good idea whenever you're poking a needle into a surface, whether it be skin or vial, to just clean the top of that as well with your alcohol. Your syringe that you'll have, the 3 milliliter syringe, may have the 22 1.5 inch needle already attached, or then that needle might come separately. Either way, we would put that needle onto the syringe to get started. So we'll need the 3 ml 3 cc syringe with this 22 gauge 1.5 inch needle for injecting. And what we will first be doing is I'm going to demonstrate a basic mixing method with this, but your clinic will review how much liquid to mix with, and they'll give you specifics. But even seeing my way of mixing is going to give you what you need to know in terms of the mixing. So for the demonstration, what we'll do is we'll mix with 1 ml 1 cc. So what we do is we draw down the plunger and we draw up a little air, and then we uncap the needle, and we first take our vial of sterile water, and we're going to inject a little air into that because there's a little pressure in that vial. So it's nice to kind of equalize that little bit of that pressure in there with entering a little bit of air into it first. If you forget this step, I don't want you to worry, but I just want you to know it's something that we can do, because as I let go of that plunger, it sort of has a little mind of its own and it's moving. But then what happens is eventually that'll all stop, and I will be able to have full control over what I'm drawing up. So in this case, we're going to draw down that plunger rim to the number 1 ml 1 cc. Once we remove that needle, this is extra fluid that you do not need to keep around, and you can put it safely into regular trash because there's been no blood contact with it, so you don't have to put it in your sharps container. Then we're going to take the sterile fluid that we've drawn up, and insert it into the powder tablet, wafer, however you want to refer to that powdered vial, and inject all that fluid in there. At first it'll be cloudy, but then just keep that needle in there, and what you're going to do with that needle while it's in there is just roll around gently. It takes a few minutes to do this step, but just let it take, don't rush it. You just don't want to shake vigorously and create a lot of bubbles with it. If you can, you want to kind of minimize all that bubbling effect. Once you see that it looks pretty clear in there, the next step is to turn the vial, or some people say invert the vial upside down. The next little cue that I always give to everybody is make sure to move that needle down as low as you can without having it fall out, because then what you're going to do is pull back on the plunger and drain every little drop that you've pushed into that vial. So 1 ml went in, 1 ml is what should come out. If you're slightly under it, is that okay? Absolutely. But if you're at a half, go back in, because that means you'll have the other half still left in the vial. So what went into that vial, the 1 ml, as close to that is what you want to remove from that vial, that 1 ml. Then this vial here will once again, this is also going to now be empty because we've drained everything. So this can go into regular trash. You don't have to put it into a biohazard container. And then you cap the needle that you've been working with for mixing. Here's where there'll be 2 differences, and I'll show the intramuscular shot first. After we have our ready mixed vial here, syringe, we're going to remove this 22 gauge 1.5 inch needle and discard, and we could open a new package with a 22 gauge 1.5 inch needle that we'll borrow from that new package. In this case, we would simply not use the syringe that came with it, but take the brand fresh new needle that's nice and sterile, because that's going to mean that's going to be good for your injection. This would be the needle that is used for a buttock muscle injection. If I were doing a subcutaneous injection on the advice of my clinic, which they will let you know, and that would be something going into the belly or the upper thigh, then you would be using a much smaller needle. So the only step that would be different is, I'm just going to take this off for a second and set it down. The only step that would be different is after mixing, I would then attach the very small needle to get ready for preparation of the injection. So we'll put that one back into that packet, and I'll come back to that. But I just wanted you to see that the mixing needle is a longer needle, so it goes in those vials, and then you may be switching to a new needle that's longer for a muscle shot, or a smaller needle that might be for that subcutaneous injection. And I'll just move everything away here. And what we're going to do is, this is an injection if we're showing and demonstrating the muscle shot first. Typically, your nurses in clinic may have drawn some circles on the upper outer quadrant of the buttocks, just to show this side here. It's just to show you that the needle's going into that red area. So we're kind of not doing a subcutaneous, which is the fatty tissue, but we're doing into that muscle, that's that glute muscle. And that's a nice big muscle for that. So a lot of times some people have asked if they can do this in the leg. It's usually preferred to give it here because this is a non-weight bearing muscle. So we sort of would avoid sometimes doing the quadricep or the deltoid of the arm because that's a small muscle. So often you'll see that your clinic centers may be circling this area for you to administer this trigger shot. If somebody, it's recommended with this one, if somebody can, to be administering this to you. And if you were to choose to stand for the injection, what I would do is if I was getting the injection in my right glute, I would stand with all my weight on the left side, and I could lean a little bit just so that I'm not wobbling. I could put down my right foot, and that person would have a nice relaxed muscle to administer that injection into my right glute. However, if you would like, you could lay down simply, and if I have this mannequin and she were laying down here and I was administering the injection, then by having her lay on her side and I'm administering the shot right here, the muscle's already relaxed. So either way is fine. There is no right or wrong way of standing or lying down. It's just whatever works for you, and that's what we would always want you to do, is whatever works for you. Some people ask if they can put a little ice to the area. For this injection, a lot of the clinics might say it's okay to put a little ice to numb the surface because you are going a little deeper and that will not interfere with absorption. Or your clinic may be working with you and may have ordered you some Sterile patches, which is a type of numbing patch that you would apply about 20 to 30 minutes before this injection and then remove it to then administer the injection. So if you don't have the patch, it's certainly okay to sometimes, with your clinics, use a little ice just to numb it. If you didn't ice, what I will say is that a lot of times by now you've had several blood draws from your arm. The pinch that you could feel a little bit here is just like a blood draw, even a lot less, because it's not going into a vein, it's just going into your muscle. So I want to give you confidence to know that not to worry about the needle going in, because you've experienced that already with those blood draws. With this, after you do the icing, or if you use a patch, what you're going to do is clean the area with a little alcohol, and then you're not going to pinch the skin. We need to leave it just as is because we want to get that needle right into the muscle. So the angle that you might see me holding this might look like a slight 45-degree angle to you, and your other hand could be here, wherever you position it that's comfortable for the person giving it. But a slight little angle, so I'm not pointing the needle down toward the floor, and I'm not parallel to the floor. It's a nice little angle so that it's going into the muscle. We don't need to jab with this. If you do see that you have a little bubble in here, or a little air bubble, is that something you want to address? You can give a little flick to the syringe. It usually rises that bubble up to the top. But if it's a real tiny one, I don't want you to worry either, because you're not using this into a vein, and that's when we really want to look for air bubbles. For a muscle shot, it's okay if you had a very small bubble there that just can't be moved, and I can even have that happen to me as well. So it's okay to flick at that to release it, but if it doesn't release, it's certainly okay to proceed with your injection. When you're doing this, like I said, it's a nice gentle angle in and a nice insertion. We do not need to jab. So you place the needle to the skin and then give a little gentle push. If you've iced or used Sterile, you might not feel anything at that point. If you didn't ice or Sterile, you might feel just a slight pinch to that skin, sort of like a blood draw when that needle goes in. The next step is to hold this needle in place and pull back lightly, gently, not a lot, not very far, on the plunger. Why we're doing that is we're just checking to see if any blood enters the syringe. If you've had these areas drawn, it's very unlikely that you will enter a little vessel or a little vein. That's the reason for this check. So I want to reassure you that it's not very common to happen, but when you pull back, if you were to see blood enter here, clinics might do different things, so you follow their instruction, but what we would do is either remove the needle completely if we see a little blood enter, put a little Band-Aid here, change the needle and go to the other side to reattempt. Or the other way you could handle it is if you see a little blood, you could pull the needle away from the skin, approximately a ½ an inch, check again, and if no further bleeding enters, then you could just inject. Either way is how you'll be instructed with your nurse's help in your clinic, but that's just addressing that if you do see blood, you don't want to insert the medication. You want to hold off and reposition or remove it and go to the other side and reattempt. Either way, eventually you will get to the point where you're not going to see any blood, and you probably won't even see it the first time, and then you'll just inject nicely that fluid, let it all go in. Can do a little count of 1, 2, 3. Remove the angle, remove the needle at the same angle as going in, set it down, and then you just put a little cotton ball there. A little bit of blood will come out, a little bit of the fluid, not a lot. It'll only take 10 seconds of holding this here, not even. And then you might have it where it will stop and it'll have a little pinprick there. And you can apply a Band-Aid if you need to. Just remember you have that there. Don't forget, because it's in the back of your body. Just because Band-Aids, even if you don't have an allergy, sometimes can get a little, you might get a little irritated from that. So you just want to be able to know you don't have to leave a Band-Aid on for 24 hours or anything like that. Just for the quick 10 or 15 minutes, and then you can remove it. If this injection is being instructed by your clinic to take it as a subcutaneous injection, then what you want to know with that is the areas typically that they will reference for you is going to be in the lower abdomen and the top upper or side outer thigh area, because it wants to be in any area that where you can pinch a little fat. So using my arm for that, I'm pinching a little bit of fatty tissue off of the muscle. And when you do that pinching, just do a little gentle lift. You don't have to squeeze too hard so that you're not traumatizing your skin by squeezing so hard. You could, with that little shot, subcutaneous injection, you could administer that to yourself, or you could have someone administer that to you. So that's an option. The intramuscular, it's usually recommended if you have someone that can give you that shot, it would be preferred. But with this injection, if you felt comfortable, you could self-administer, or you could have somebody give you the injection. If somebody were to have someone else give them this injection, I usually sometimes recommend that the patient could lay down and you would administer it into her belly this way, because it's a 90-degree angle, or you could administer it into the top thigh this way. Or if we're doing the side thigh, then the 90-degree angle to the side thigh is administering it like this. So it's a 90-degree angle, and if you're getting the shot given to you, then you could lay down. If you are administering the shot to yourself, then you would be in a position of where you could stand or sit, and you would be giving this straight into your belly, straight into the top thigh, and bring it into the side thigh to the side area, like we showed earlier, a little bit of that side thigh. So again, the angle for this one is a straight in, but it's a smaller needle just going ½ an inch into the fatty tissue. So if we demonstrate that one, if somebody were self-injecting, question might get asked, can I put a little ice here? You could, but it's sometimes is recommended if you're going to do anything here, maybe to use one of the numbing patches if you have that option, that's ordered for you. But even if you don't have the numbing patch ordered, recommendation is you don't really have to ice these. It's such a tiny needle, you may not even barely feel it. At most, it might feel like a mosquito bite. We all know how that feels. It's a very quick, fleeting pinch. The reason sometimes we recommend refraining from icing with the smaller shots is that you don't want to constrict blood flow. Blood flow needs to be open in the little capillaries to help that medicine be delivered to where it needs to go. So the idea here is just we don't want to interfere with that. The numbing patch won't interfere with that, but the ice, if you leave it on too long, could. So it's best to just know that you really don't need the the ice for this. And oftentimes patients, when I do demonstrate this, they will let me know afterwards that it really wasn't as bad, and I was right, that it felt like a pinch or nothing at all. So I want to reassure you all of the same thing, that it really is something that you won't notice very much when the needle goes in, because it's so fine, that needle. This time we do need to give a little pinch to the fatty tissue. So what you want to know with that is you're giving a gentle little squeeze to the skin, like I said, not a harsh squeeze. You uncap your needle, and then when you have that little pinch of fat, you place the needle right to the skin and just give a gentle little push. Once it's all the way in, you can then push the medication in, nice and gentle. Count 1, 2, 3. Remove the needle, same angle as going in, let it out, and then put a little pressure there. Here, if you'd like to Band-Aid, you usually don't though. If anything, you might see a little clear fluid come out of this opening. So that's the medicine. So we want to make sure we put a little pressure and keep it there, keep it inside the body, but usually not needing to have to do anything with any sort of Band-Aids or anything like that. And then with all of your medications, after you are done with them, when you have this dirty needle and syringe, it goes into that sharps container. So there is no leftover with trigger HCG. Everything you typically mix is going to then be utilized for that evening, that day, or that evening, or that morning, whatever time you're taking this. Your clinic will give you specifics with when you're taking it, how much water you're mixing with. Today's demo was to just show you the demo of mixing, and we use 1 ml, 1 cc, but you might use more, you might use less, or you will absolutely be instructed whether you're taking it as a belly shot or thigh shot, little tiny injection, or whether it will be in the muscle. So I do hope this video has helped you. If you've gotten to this point, I know you have good things ahead, and we congratulate you on getting to this point of a trigger shot, and best of luck to you with the rest of your cycle. And we'll see you back here for some future videos. So that HCG trigger is very, very similar with mixing as that menipure was. So it's kind of nice to see two of the mixing products together, maybe back to back, just so that it gets them in a way out of the way. But as you saw, as I mentioned, with HCG in your clinic, they will advise you on a specific dosage. And also that it could be administered one of two ways, as a smaller injection or as an intramuscular shot. And again, that just is your clinic with their experience and how they would like you to receive that medication, but they will definitely review that with you. Craig, I don't know if we have any other questions that are up there for that medication.
Yes, so a couple did come in, and let's jump right into it. So this question comes off of when you had mentioned a couple of the different names for HCG that are out there. And the question comes in saying, I know you mentioned a couple of the names that I've heard of, the Pregnyl and Novorel, but are these HCGs interchangeable? Are they fundamentally different in some way where I couldn't switch between them between multiple cycles?
Actually, for the most part, that's a really good question, because there are a couple different trade names. And so what I want you to know is oftentimes they are interchangeable. Sometimes you might have a formulary within your pharmaceutical benefits that might require a particular name product, but not always. This one is one of those that often is a product that we can interchangeably use the different products available. So when the pharmacy has something available, they'll run it by your clinic to confirm that it's okay for us to be able to authorize any interchange of the medication. So most often you will find that it is interchangeable, and it'll be that your pharmacy and your healthcare professional will review that together to make sure that it is okay to give you a different brand name, if that's fine.
And that's actually a perfect, like you mentioned, that's a nice segue into the idea that part of what we do at Mandel's is work very closely with not only you, the patient at home, but also with your clinic in programs like this, but specifically in terms of treating you, so that we can assist to make sure that we understand those situations where something can be, switched because of an insurance coverage or for cost savings, versus when are things like, no, this is the product that we need because it's the one that you need specifically for your cycle that you're going through. So a lot of that stuff is really just it's teamwork between all three parties to make sure that we can come together with the right answer to get you the best possible medications that you need at the best possible costs, and also to make sure that we're all on the same page in terms of if you have questions about how to use said products. So thank you very much, Wanda, for mentioning that, because it is definitely a critical part of the process, is making sure that everybody is involved in that choice. So great on that. So let's see. Now, this question is a little bit more, you touched on it a number of times, and I think it's still something that's a little confusing sometimes to people, just the concept of the trigger shot in general and how it works. And I know you did mention it not only just in this conversation, but also when you went through menipure, but obviously there's still some questions out there. And this one says, so how does the HCG shot work to quote unquote trigger my cycle? What do we mean by that? And what, more importantly, what natural process in my body is it replacing?
Good questions. What you want to know is when we are putting sperm and egg together, whether it be with an intrauterine insemination or outside of the body in vitro in a laboratory in a petri dish, and you're putting sperm and egg together, it's important for the egg to have gone through the process of ovulation. So the process in our bodies, when we take the trigger shot, when we take HCG, Pregnil, Novorel, the different, even Ovidrel is another name that you'll hear of a medication to induce an ovulation. These medications finish the final maturation step for the egg and is allowing it to prepare for then fertilization with sperm. So oftentimes this is why this is that final trigger, that final medication that's taken right before those procedures, because it's finishing up its final maturation step for those eggs and then preparing them for fertilization. So that's the action of what is happening within the body when you take any variety of those products within your cycle.
Perfect. Thank you. Yeah, I think it's something that can be a little confusing to people, just kind of understanding how all these different parts are working together. And especially that kind of second half that you answered there, Wanda, on like what part is it replacing in the process? People sometimes get a little confused about what medication is, replacing what part of the process that would naturally have happened if I wasn't having to go, seek treatment. So it's really nice. Sometimes it just puts your mind at ease knowing why all the medications are here and what they're doing for you and what parts they're helping you with, so you can get to that end game of obviously what you're looking for is taking home that baby. So it's great to be able to have a little bit more understanding there. So thank you so much, Wanda, for that. So let's see, another question. And again, I know you talked about some of the different sizes of like the dosages that people might take and how that is kind of dependent on what, you have to wait and see what your clinic says, what your HCP will tell you. But this question comes up that why are the injection volumes so different between these HCGs and Ovidrel?
So volumes or strengths can refer to a couple different things. So your volumes would be how much liquid you might be injecting or using to mix. So the way an Ovidrel shot is just it's a pre-filled syringe, and that is typically a tiny injection that's going into the subcutaneous fatty tissue. So oftentimes that's why that has a 0.5 cc of liquid, because you don't want to put a lot of fluid oftentimes in that little in that subcutaneous area for absorption, but you can do anywhere from a 0.5 cc to a cc of fluid. So in terms of volume amounts, if we're talking liquid, we're talking milliliters, cubic centimeters, a 0.5 cc, 1 cc, 1 ml. Those amounts are determined by just your clinic, again, with how you can mix. And there is variation, but with Ovidrel, that is a pre-filled syringe, and that is already mixed for you, and that's going to go subcutaneous in the fatty tissue. So that has a 0.5 ml of liquid, but then it has a certain concentration of HCG amount that it would administer. And the HCG that I just reviewed and showed the 1 ml for mixing, really with muscular shots, you can do 1 ml, sometimes it's 2 mLs. It just, again, will vary with how your clinic wants you to mix that. But then there could be potentially different concentrations of the HCG within your injection. And what determines a lot of this is really, again, you as an individual and your response. We have patients sometimes that are cycling for IVF, and they might have a numerous amount of eggs that have grown and developed, so they might not need quite as much concentration of HCG in their volume. So they might get a lower concentrated mixture. That's because that's what they need. Somebody else might need the full concentration because they just might really benefit from getting all of that HCG. So really a lot of that is the nurses know the mixing of all of this and know how the different products are supplied. But we do rely on your physicians when it comes to the concentration or the amount of the drug that's in that fluid volume. That's where we're relying on doctors, because they're looking specifically at your response to determine what you need.
Thank you. That's perfect, because sometimes that can be a little confusing between concentration, volume, and all of that for people who might have some of these questions. Sometimes you may have gone on to a blog or something and you read, you hear these different terms thrown around, and sometimes it's a little bit hard to parse out what everything means. And so that's, again, another great opportunity for whether you are at your clinic specifically or just here doing the PharmAssist program where you can ask these questions live make sure that you do understand, so that again, our entire goal, and we keep saying this over and over, but it is important to mention that the goal is to make sure that all of these questions you can get out of the way now, so that by the time you're ready to give that first injection, all your questions have been answered and you can just focus on, following the steps that you need at hand to make sure you get to that step that you need to get to. So we're really trying to make sure that you can feel confident and comfortable, because we know questions can sometimes lead to nerves, and we want to make sure that the questions get answered beforehand so that we eliminate the nerves and just have the questions become knowledge. So thank you so much. It's a great answer. And with that being said, it looks like we have answered most of the questions so far. As always before, we'll give another like 30 seconds or so if people are trying to get an answer in or a question in based on that answer you just heard. But in the meantime, I will throw it back over to you, Wanda, if there's anything else you want to share before we move on to our third and final product for the evening.
One final thing I maybe would say about the trigger shot, and I know I might have touched upon it in the video, is that that'll be a very specific time, obviously, in the cycle. And it sometimes is when you might meet, even during the moments here of COVID, you might be able to still meet with your nurse to review that particular injection, because it is such an important, part of the cycles. And with an insemination cycle, there might not be a specific time you have to inject, but there might be a range of time that's provided to you from your healthcare professional of when to give that injection. But for fertility, for the IVF cycles, it may be that we give you a specific time to inject that medication. So one thing I'll just emphasize with that is, if you're ever given a specific time to inject a medication, you really do want to make sure you're staying to that. There's very few drugs here or medications that need specific timing. Some of them are a range of time, but with the trigger shot, you may hear that there's a medication out there that I have to take at a very specific time. That'll be the medication that you just saw that we just reviewed, that sometimes for sure with IVF, you might get a very specific time that you have to take that medication. Okay. I think we're good, Craig. We don't have any more questions. So
no more questions.
We're good?
All good. Yep. We're ready to move on.
All right. Perfect. So the next and final video that we have, the medication here, is going to be the Cinera patch. And this is a medication that your clinic, you could ask them. Sometimes if you're somebody who really has a considered like a strong aversion to needles, or you've had some issues in the past with getting blood drawn, this is something that you might want to see and talk to your nurse and doctor team to see if it's something that they would consider ordering for you through a pharmacy. It is a nice way to help calm, as Craig has already brought up, a little bit of the nerves when it comes to getting blood drawn in your clinic or having to take the injections. We certainly don't want that to be an obstacle for you in getting through the cycle. And so sometimes there's just little techniques you can do at home using a little ice or something like that. But sometimes it might warrant something a bit more for you. So the Cinera patch is a numbing type of patch that can be applied to the arm where you might be getting a blood draw, or it could even be applied for where you might be giving a injection in the belly or in the muscle. So the next video that you're going to see here is going to be that Cinera patch, which is a numbing patch, so that it helps you get through those shots or maybe even a blood stick. So without further ado, we'll watch that video. Hi everyone, this video is to give you some instruction for using a numbing patch that's available to you if you have difficulties with having shots administered and you're very concerned, or sometimes some people have a tough time getting their blood drawn. And this can be a useful patch to have your center call into the pharmacy, and the pharmacy will check and see what your coverage is for it. But the idea with the patch is just to give you another option of something that might help you in alleviating any fears about blood draws or medication administration. So this medication is called Cinera. It comes in a box that will look like this. Oops, pardon me. Let me put it the right way. And then there are, I believe, 10 patches in here per box. Each patch is a one-time use. So you don't reuse the product. Once you apply it, kind of think of a Band-Aid. You apply a Band-Aid and it might get soiled after you discard it. So each patch is a one-time usage patch. And so when you are applying this to have either a blood draw, okay, or to an area that might be getting injections, which sometimes for fertility mainly could be the buttock area. Some people might want to apply it for the little areas, shots that are in the belly or the upper thigh. But once you get the okay and you have a prescription that does get called in for you, what you want to know is, make sure that the skin area that you're putting this on is not having any cuts or any abrasions or anything that's an open wound. You want it to be clean skin, but you definitely want to make sure that you have no cuts or abrasions or anything like that on those areas. So you would clean the skin first and foremost. And what you'll see is the patches come in a packet, and you will open up that foil pouch and you'll remove the patch and place it with the foil side up. What you'll find here is there is a little sticky, there's a little sticky area here that I will pull off, and then there's a little a harder plastic area. When this goes on is typically 20 to 30 minutes prior to getting a blood draw or getting a medication administered. So you want to apply it to that area. Careful that you don't touch the area that has, you'll notice that there's some little dots in here where it breathes, the Band-Aid. But once I remove this, like a lot of times even Band-Aids that might have a little bit of medicated Neosporin already in them or whatever, you don't want to touch that area. So same with this, is that you don't want to touch that area. And then you peel it back and off. And so this is the part that's going to stick to the body. And then just for the sake of my demonstration, what I'll do is I'll grab my mannequin that I have. And if we were going to have her, for her muscle shot, utilize this, we would take the foil side down, not touching it, and apply it 20 to 30 minutes before where she's going to get her injection. And she would leave it on, or she would apply it, I should say. She would apply it to that area, leave it on there for 20 to 30 minutes, and then remove it prior to the injection. When you do go to remove this, what I want you to be careful of again is not touching the inner aspects, that silver part. And so in order for that to be safe for you from animals, from other children or anybody, is your packaging. What's nice is you can just apply it to that packaging and then discard. So save the outer foil pouch to be able to utilize that for discarding your patch safely. So there's a bit of numbing cream, lidocaine, there's a little bit in here. And what those, like I said, those numbing agents can be helpful for some people who maybe really have a potential needle phobia, very concerned about their injections, even, might be a little bit of a difficult blood stick. So this is something that you can always talk and discuss with your fertility clinic, your nurse, your team, and let them know your concerns, because I think all of us would agree that we want you to be able to get through your cycle. We want to do everything we can to empower you to feel comfortable. And so if this is something that is going to help you to make that next step and take that next step to the fertility journey, then we want you to know there's some things out there for you that can help. Thank you again, and best of luck on your journey with your fertility cycle. So that was great for us to see that there is something out there that is available through a prescription that you can use. So keep that one in mind, and certainly ask your team if there is any need on your part for something like that. By all means, just run it by us. I know that there might be a few questions with this one that Craig will let me know of, but it's just key to let everybody know that something like that does exist. Sometimes we ask you to use things, or you could use things like ice, like I said, or even a little heat after an injection, which these are little tips that we give you. But it's also really good to know that there is something out there that might be a little bit stronger for some patients that might need that for both their blood draws and or the injections that they're taking.
Perfect. So one question that came in is just pretty basic. It just says, I know that this product is there to help with the idea of side effects or pain associated with my other medications, but are there any side effects that the patch itself causes that I would have to be aware of?
The biggest thing that the patch is used for is to numb the area. So sometimes you might feel a little warmth when you put it on, but the biggest thing would just be once you're done with your injection and after, for a little bit, that area will be slightly numb. You won't feel anything because of that, what it's doing, which is numbing and helping with pain to the little receptors in the nerves there. So just know that that's something that could be going on after you've taken that injection or even that blood draw. So you just want to be careful to not scratch that area, because you may not know if you're scratching it too hard, because you may not feel it. And you want to be careful of like temperature changes, of applying something too hot or too cold to the area. But mainly it's the symptom, the side effect of the numbing is just reminding yourself that it is numbed that area for a little bit. So it did its job for the injection or the blood draw, but that's probably the biggest thing that you just want to pay attention to then for a little bit after that. So you know that it could stay a little bit numb there, and you want to be careful of what you might be touching or scratching at that area, etc.
Perfect. Thank you very much. Appreciate it. Let's see. Another question came in that says, and so this is probably a little bit of a combo question about not only this, but the associated medication that you're taking it for. And it just says, is it okay to delay some of my shots for a bit if I forget to put my patch on in time?
That will depend. I guess the best way for me to answer that is, as I mentioned in the HCG video, a lot of your medications, you pick a time as a patient for most of the medications that you're taking, times that work for you, maybe in the evening or in the morning. And it's usually a range of where you have maybe a couple hour window. So usually with any medication that's not time specific, but it's a specific time of day, morning or evening, with anything that's a specific time of day and you're picking the time you're taking it, then you have a little flexibility. If you forgot, ooh, I didn't put on the patch yet, certainly putting it on and then being able to do your injection is usually okay. The key would be with the trigger injection. If you're taking that injection and you're taking it at a specific time, one little tip is I always tell patients, we have our phones, set an alarm on your phone, for about 20 minutes, 30 minutes before when that shot is, that'll alert you to put that patch on. So use your phone as your ally in that case, because when it is a specific time shot, you do want to get that patch on in enough time to be able to have the nice effect of what it's doing for the numbing and the pain relief.
Great. Perfect. Great question. Thank you so much. And great answer as always. And then Wanda, let's see this one coming in that says, how long in general should it take for the patch's effects to wear off? So I guess in as you were mentioning before, the idea of you might not know and you got to be aware so that you're not scratching or you don't lean against something and not realize that you don't feel that it's something hot or cold. I guess this question is saying, just so I know, about how long should it take to wear off so that I can be aware of that.
I might need your help on that one, only because I have looked that up before, and I don't know. I feel like I've read if lidocaine is given and directly like as an injection, I think it can take like up to an hour and a half is what I've read with that. But I don't know if I've seen in their literature for the patch. I guess I would say it could take about an hour maybe after it's been applied, but I didn't know if there's a specific time that I've noticed from that manufacturer on that. So I don't know if I would have an exact answer to say. And I'm only going by my own experience with Novocaine. When you get something like that in your mouth, it could take an hour and a half, 2 hours sometimes, but that's because that's gone into your bloodstream. So this is going into that area, but not a direct hit like an injection.
Right. I think, this seems like a question that I'll say straight up first that if we come up with a better, more like specific exact answer from the manufacturer, we will certainly post it alongside this video. So make sure that we can get that out there. But I was going to roughly, on my end, what we would typically say is about the same thing. It's more of that, about an hour and a half,
Yeah.
Could be a little bit less if you leave it on a little bit less. It could take a little bit longer if you leave it on a little bit longer than normal. But around that hour time frame is when you'd start to, I would, that's what we would start to say is most people will start to regain some type of feeling where it's,
Exactly. That's what I was thinking.
It's coming back.
I was thinking about an hour, but I wasn't, 100% certain either. That's
exactly. And I think, again, this is more just a part of this is all questions coming from, people asking like, what's your best recommendation? And so in this case, because of a specific medication, we can, like I said, I will find out if there is a specific, like exact answer from them that they want to make sure we get out there. We will certainly, tag that and put that on this recording so that when people go and watch it on demand on Facebook or anywhere else, they will see the answer to that as well. But yeah, I think that's roughly the answer we would give. So we're right in sync.
Yeah. Okay, cool.
Good.
Cool.
All right, nailed it. Well, it looks like, this one's a pretty easy one. It's a patch, that helps to get rid of the pain. So there's not a whole lot usually of questions around that. So I think, let me just take one last check. It looks like we're all good. I think we've all caught up. So as always, I just want to throw out, we'll give another like 30 seconds or so. If you have a question about any of the 3 products or something, related to what we talked about today, feel free. We certainly have some time. And in the meantime, I'm going to turn it back over to Wanda to begin the process of wrapping up tonight.
Okie dokie. Thanks, Craig. So I hope in conclusion with these the videos tonight and the live question and answer session, that it was able to give you some answers to a lot of the questions that you could have about your medications. And hopefully if you're trying one of these medications, this was a nice compliment tonight to see this video. Keep in mind that these are recorded, these events, as well as all of the videos are also on my Mandel's PharmAssist program, and also the videos themselves are recorded for Facebook, for YouTube, and the Facebook page of Mandel's Pharmacy. So that's really important to know, because I think, again, it's nice to see things over and over and they're helpful, but I really do believe that you watching them once before you have the product, and then once the product arrives, watch it again. But there's no time limit on how many times you have to watch and how many times you should be watching, whatever you need to do for you. Something I always like to do at the end of the videos or the end of the events that I host here a little bit with Craig, co-host, is I like to give you a little wellness tip. Something else that I do as a part of our practice and with my coworkers, sometimes with patients, is some tips on wellness, because I'm also a certified healing touch practitioner that handles the energy, the body's energy centers, the energy field. And so there's some cool little things to know that you can do. And I thought with the virtual aspect of things lately, with everybody having to do the virtual thing, and sometimes we have to keep that social distance, this is really a little tip to help with stress and any feeling of angst or anxieties in terms of your cycle, in terms of just going through this process, in terms of injections. And it's a recent little article that I had just read in my energy magazine, and it's called the Forward Backhead Hug. And I kind of like that, because I feel like we can't do a lot of that right now. And when you're home, if you're doing this cycle by yourself, or if you do happen to have a partner or a friend or somebody that's helping you, this is a great little technique that you can give to yourself, and or you could give to someone else. And so it can be shared if you're living with someone in the home and sharing space with them, that you guys are not having to be distanced from one another. And again, it's something to help stop negative thoughts. It's helped to, if you're feeling insomnia. So really, when we are in stress and we have the fight, flight, or freeze, the blood flow leaves our forehead area, our frontal lobe, and it goes to our extremities, because that's what helps us fight. It helps us flight, run, or it helps us freeze. So the blood leaves that area right here. And so what happens is, once that trigger's gone, and the thing that triggered you to feel that anxiousness, the effect in your body still stays like that. And if you don't move the energy, then that, even when the stress is not present, you might be still feeling that unrest and that unsettled and not calm and whatnot. So this is a nice little technique, because all you're doing is taking, doesn't matter which hand, if you're doing it to yourself, a gentle touch to your forehead, and then a gentle touch to the back of the head. And so what you're doing is, think of it as the forehead or forward backhead gentle hug. And you can be sitting up, you can close your eyes, you can put on light music, you can be laying down. If you were giving this to someone, they could lie on their side, and you can have your hand on their forehead and your hand on the back of their head, just gentle. So the time frame, there's no right, wrong time. 5 or 10 minutes is really nice. But what you should kind of feel is you have energy centers in the middle of those palms, And so when you hold your hands there gently for a little while, you'll eventually start to feel maybe a little pulsation. When you feel that pulsation, you have released and allowed for the energy to flow, which means it's really going to help you with release of the thoughts and release of the energy that kind of needs to go back to this area that was left that area for the fight, flight, or freeze. Okay, so I hope that little technique helps you. Remember, it's the forward or forehead and the backhead hug. And it's a gentle hold, and you can do it to yourself or you can help somebody else. And it's a really nice technique that even if you're receiving that, it's really hard to think those really racy thoughts when somebody's got their hands on your head like that. It's a really nice feeling. So I encourage you to share this with the person that you might be sharing this cycle with, helping each other out, calming any stress that's being stored, because with fertility, there's a lot of terms, a lot of things you're thinking about, a lot of new things with the medications. And so it's not unusual for our patients to feel that sense of stress and a little not at calm, not at peace. And we want to do everything that we can. Our brains work really well when we can calm them down. So I hope that little technique, that little tip is useful to you within your cycle, and you can do it whenever you need it. And it doesn't just have to be with this fertility cycle. It can be at any time when somebody's experiencing racy thoughts, times of stress, or a little insomnia. So thanks, Craig.
I definitely know I will be doing a forehead backhead hug immediately as soon as this call is over, because that sounds great. And who couldn't use a little bit of relaxation, right?
Who couldn't use a little hug? It's a little hug, right?
A little head hug. I'll take a head hug anytime. Thank you so much. I definitely want to say, Wanda, thank you so much for all of your time and all of your expertise tonight. It's always amazing to have you on here. You always have amazing stories to share and the information to share, but also then just kind of make it be very, very conversational. And we love having you on. So thank you so much.
Oh, I love being here. Thanks, Craig, for having me.
Absolutely. Thank you. And then thank you to everyone at home. If you're joining us via Zoom or Facebook Live, thank you so much. You are really what drives this program, and we do appreciate all of the great questions. We hope that you were able to learn something tonight. And we hope that maybe, just by having the conversation, you were able to kind of be a little bit more at ease and ready to go for that next step in the process. So thank you so much for joining us at home. As always, and I know we just mentioned it, and I know Wanda just said it herself, but just want to repeat again that all of these programs, the virtual learning experiences, the VLEs, as we like to call them, as well as the bite-sized little videos themselves, everything is available on demand. So you can find them on our Facebook page, on our YouTube page. You can find them at our homepage, which is mymandelsPharmacy.com/PharmAssist. So you can find everything there. So if you watched everything tonight and then you want to watch the video of just the menipure, like 5 seconds before you're about to give that shot, feel free to just boot that up and sit down there. Maybe you want to watch with somebody else so they can get some of the information that you have, whatever you need. We want it to be as easy as possible for you to get access to it. So we look forward to everybody. If you can come back here again next Monday night, we would love to have you here at 7 p.m. Eastern Standard Time. And the most important thing I can say is if you thought that this was valuable, please, please, please share it with somebody that you think can benefit from it, whether it is a family member, a friend, a colleague, somebody that you bumped into on the street or walking into Target and they look like they're really waiting to find out about the forehead backhead hug. Just share it with them and let them know. Because
Wanda Virtual.
Exactly. Wanda Virtual. That's how you can share about Wanda Virtual. And that's really the best way to get this information out there. So thank you so much for attending, but then let somebody else know about it. So with all that being said, thank you again, Wanda.
Thanks, Craig.
We loved it. I had a great time again tonight. And I look forward to seeing you guys again next week on our PharmAssist program. Thanks again. Have a great night.
Bye, everybody. Have a great night.